Good morning, everyone. This is Katie Hodges with the Iowa Healthcare Collaborative. I want to welcome you to our Falls Community of Practice event for today. We are going to go ahead and get started. Joining me today is Jennifer Nutt with the Iowa Hospital Association, and she is going to be going through our introductions and our introductory statements. Jennifer?
All right, good morning, everybody. As Katie said, I am with the Iowa Hospital Association. I'm the Director of Nursing Clinical Services for IHA. Before we get started with today's presentation, I just wanted to touch base with you guys and see kind of what you guys felt were the best takeaways from last month's presentation.
And we have unmuted everyone, so feel free to add in. Again, this is to be an interactive conversation.
Or another question I'll pose out to you, was there anything from last session to now that you have implemented or changed in your Falls program within your organization?
I know we've got quite a robust community of practice, and I see a couple familiar names that are on here that I know that have been really active in their falls, so we'd love to hear from you guys. Okay. No pressure for anyone. Just remember, as we go forward, one of the key parts that we have for our community of practice is that we want to collaborate and share together. So rather than just having webinars that are kind of didactic and sharing success stories, which we really want to do, we want to take that back. But we want to hear from each of you guys on what you're doing, or if you've started struggling with something, or if a new idea popped into you. So be sure to keep that in mind as we move forward.
All right, and then before we get started, I want to just give a reminder to everybody that if you are not signed up for the Hen Hub, please go ahead and get signed up for the Hen Hub. It's a great platform for you guys to connect with each other, and so you guys can learn from your peers and have access to resources. If you have any questions on how to get signed up, you can contact Jennifer Kriegmer or Jennifer Brockman here at IHC. And then we are recording all of the Falls Prevention Community Practice webinars. So if you are wanting access to any of those, they are on the IHC website under the PFP Hen resources, and it'll be under the focus areas and then Fall Prevention Community of Practice. So with that, I'm going to go ahead and introduce our speakers. Our speakers are from Community Memorial Hospital in Sumner, Iowa, which is a Unity Point Health facility. Under the guidance of their Fall Committee, Community Memorial was recently recognized for their collaborative efforts in preventing falls hospital-wide. Staff have been working to prevent falls on inpatients, outpatients, visitors, employees, and they saw a success rate of a 38% decrease from 2014 to 2015. Community Memorial was nominated and awarded the 2016 Patient Safety Award for reducing hospital-acquired conditions from the Iowa Healthcare Collaborative. Today we have members from the Community Memorial Fall Committee with us to share some ideas and best practices for their success. I'd like to introduce Deb Varner, who is the committee chair, and other committee members, Lynn Neiman, Sally Youngtum, Stephanie Hansen, Jenna Lee Teeling, and Ann Brock. So Deb, we're going to go ahead and turn it over to you, and just go ahead when you're ready for us to advance the slide. Just say next, and we'll keep the slides going.
Matt, this is Christy. I have a question for you. If you can give me a call back, 6405. Thank you.
And just a quick reminder for everyone on the call, we have gone through an unmuted line, so please make sure to mute your lines on your side, please. We are getting a little bit of background noise.
Hi, this is Deb Varner, and thank you for having us today. You can hit the next slide. So our Fall Committee was developed here at Community Memorial at the beginning of the HEN 1.0. Our nursing staff comprised most of our team, as our initial focus was exclusively inpatients. We've started to expand that, where we recently added our safety officer. As during our research and problem solving, we needed his help. Our disciplines are included as, other disciplines are included as issues arise and they pertain to the area. I put a picture of us here, the ones that got to go and receive the Patient Safety Award this spring. To the far right is Sally Youngtum. Going left is Lynn Neiman, then myself, Deb Varner, Stephanie Hansen, and Dr. Evans. Dr. Evans. Next slide, please. I just wanted to review what our fall committee does and its function. We meet monthly. Our fall reports are reviewed. Interventions are evaluated and reported, and new issues are brought forward. I wanted to share some of the things that we are working on right now. It seems like our parking lot was an issue for us this winter. So we've been researching ways to keep our parking area clear of snow and ice. We've been looking into different products and different work that other places are doing in our community. Another project that we're working towards is identifying nursing home patients that are going to our clinic that's in our hospital to see if we can easily identify which of them are at risk for falling and how to do that confidentially. We have a few ideas, and we're working with our local nursing home to try to implement some of those. Our fall committee minutes are posted for all staff to see electronically. We do, like I said, we brainstorm on new solutions, and we also attend updates and educational programs throughout the year to try to keep with the latest information and ideas on fall prevention. Next slide. In 2014, we developed a hospital-wide fall prevention policy. The policy, we did education so that our staff would understand the definition of a fall and how to prevent them. Some of the interventions included educating on our whiteboards that are in our room. They have our Morris Fall score on those, and the staff was informed on how to tell by the higher the number, the more at risk for fall the patient is. They were notified of the different alerts that we have in our facility that tell us the patient's at risk for fall. They were shown how our alarms work, how we activate them, and how we ensure they're activated before we leave a patient. All staff take responsibility to prevent falls, and we also started post-fall huddles. So the policy and the education listed above were presented at a quarterly all-employee meeting, and we've done several updates at different employee forums. Next slide. Our Community Memorial Board of Directors supported this initiative by tying part of our annual employee bonus to the number of falls at our hospital per year. The administration tasked our fall committee to prevent falls throughout the hospital and its grounds. All falls are included in our bonus program. And this has brought a lot of attention and focus for all the staff at our hospital. Our employees are to notify the appropriate staff of any unsafe situation that they have and to make sure that that situation is corrected. And most of the employees are also contacting the fall committee to make sure that we are also aware of that situation. Next slide. So in January of 2013, we opened a new hospital. So you would think, oh, our building is really safe and we don't have any issues with that. But just to make sure, our fall committee developed a worksheet and we assigned ourselves different areas of the hospital to evaluate for fall hazards. And in our new facility, we were amazed and shocked to find out some of the issues that we identified. Some of them, I have some examples here. Like we found that we were totally missing a call light in the bathroom of our outpatient clinic. We found loose tile in one of our bathrooms. Our floor outlets were posing a fall risk because they were in the lobbies, they were open. And so we discussed it and problem solved, and we found a way to cover those outlets without spending any money. And what we did was we just rearranged our furniture. And housekeeping was notified that they were always to keep those covered with furniture. We found some concrete elevations in our sidewalk. Some of those had to be ground down. We have an area right by our front door this winter. When spring was starting, it dropped, and we had to put some large cones and some tape to prevent any patients falling there until the ground thawed enough, and then it's back to level. So it's a kind of an ongoing process of evaluating our outdoor environment. We had some curbs that weren't painted and they dropped off from the sidewalk, so we had those painted. We've had to add some handicap accessible doors to our main bathrooms. They had very heavy doors, and a lot of the staff had noticed that the elderly were having a hard time navigating them. We found that we had some ice accumulation under an awning that our patients drive under, and then they can get out. They were leaking and causing ice. So we had to call the construction company and have them come back and fix that, and we're continuing to monitor that area. So we do periodic environmental rounds, especially during seasonal changes. And one of the new things that we've just decided to do with our rounding is we're testing alarms and our response to them in different areas throughout the hospital. One of the things we learned is that with new staff that they weren't aware of how to unlock a bathroom door if a patient had fallen in there. So that was another good experience for us during that testing. Next slide, please. One of the more recent interventions that we've done on our inpatient was developed because we were not sure if our patients were being educated timely about fall prevention at our hospital or if it was being missed. So we added these kits, and all they are is a clear plastic box, and they're in every patient room in their drawer. And inside of them are the yellow non-slip socks, gait belt, educational brochure, and our fall risk armband. And so when the patient's admitted, the nurse brings that kit out, and it's a really good reminder for her or him to do that education with the family and the patient. And we also encourage teach-back to be used to ensure understanding. And then at discharge, that kit is restocked and then placed back in the patient drawer. And we feel that we're getting a really good response from the nursing staff with this. Next slide, please. We've also added some signs. In our patient rooms, in front of the bed where the patient's facing, there is a bulletin board. And the picture to the right that says, "Call, don't fall," we added that to that bulletin board. And in the bathrooms, we added the one on the left that says, "Call, don't fall." And in both of the pictures, those are the actual call systems that we use so that the patient could see that and then know where to push. We put the one in the bathroom because we found that studies show that the bathrooms are the most dangerous place, and we wanted to keep that at eye level and encourage our patients to use it. Right after we implemented it, we had a patient that said, I was just going to get up, and then I seen that sign right in front of me, and it said, call, don't fall, so I called you. So the nurse really liked that those signs were there, and they liked seeing that they worked. Next slide, please. Other interventions that we've done here at Community Memorial are we have a lighting system above our patient doors, and as you can see in the picture there, there's a yellow light, and that indicates the patient is at risk for a fall. And also, our door signs to the left of the door have flags that the nurse can pull out that say the patient is at risk for fall. We, like I said before, use the yellow nonstick footwear and the yellow armbands. We also have bed alarms on all of our inpatient beds, and they have 3 different sensitivities that the nurse can adjust according to the patient needs. We have chair alarms, we have personal alarms, we have the whiteboard with the fall risk score and an alert that says the patient's at risk for fall. And we also do fall assessments. We use the Morris scale every shift and following any fall or change in condition. Next slide, please. Another intervention that we've implemented here is the post-fall huddle. So when a fall does occur, all pertinent members of the team are gathered together to discuss what happened. And this can include our maintenance department, members of our housekeeping, dietary, our physical, occupational therapy, our nursing staff, patients. We really want our patients and our patient's family to be there, and a provider if applicable. And the purpose of the fall huddle is to gather information, learn, and prevent any further falls. And we found that with the patient and the patient's family giving their input, we can learn a great deal from that. So that's why we really want them involved in that fall huddle. Next slide. So we've also implemented some community fall prevention interventions here. And one is that we went to our community care transition team and we presented our fall prevention presentation there. We have matter balance classes a couple times a year here at the hospital. And we're integrating awareness in our clinic and our referral process. We've educated our clinic on the STEADY program, which is a federal program by fall prevention. And we also have now started our Tai Chi for arthritis and fall prevention. And Tai Chi improves balance and physical performance in the older adults. And we're having a really good turnout on those. So we're having 2 classes going on right now at this time. Next slide. So I just wanted to share a graph of our falls from 2014. And you can see we included our inpatients, our outpatients, our visitors, and employees. And then next slide shows our 2015 statistics. And I just wanted to share with you from April of 2015 to April of 2016, we have only had 1 inpatient fall, so we're really proud of that. So our next slide, I just want to thank everyone for listening to our presentation, and I have our fall committee members here, and we would love to hear any questions that you may have. Thank you.
Thank you, Deborah. And we are opening up everyone's lines now. So I do know there's a couple of folks that were having some issues with being able to call in. So if there's a question that you have or anything that you want to share, please feel free to also put it into the chat box. We'll open it up now. Most everybody should be unmuted if you're not already. So feel free to ask any questions or any comments or anything that stood out for you from their conversation and what they've been doing with their falls.
Deborah, I have one question for you. This is Jennifer here at IHA. When you were in the process of implementing this program, was your administrative team very supportive from the beginning, or did you have to kind of get them to buy in?
Just some of the meetings just to see what we're doing.
Just one moment. I think you guys you had clicked a mute on there, so we just got that last bit. Sorry, if you want to restate the beginning part of that response.
Sure. I said our administrative team has been very, very supportive. Sometimes our CEO will even come in and just want to listen to a meeting every now and then just to see what we're up to and how it's going. And so, no, they've been very supportive. If we find problems, they've been real responsive in helping them get those corrected as well.
Wonderful. Are there any other questions or comments for Deborah?
This is Christy, and I typed some questions in the chat box. If you can read those. I'm not on the line.
Let's see. The question that I'm seeing on here is, what is your nurse-to-patient ratio?
It's 1 to 6.
And then Christy, I'm not seeing the one in the chat line that goes all the way through, but I do see that we're able to hear you speak now. If you'd like to just go ahead and ask your question.
How soon after the fall do you do the post-fall huddle?
We try to make sure, of course, the patient's stabilized first, but as soon as we can gather the team, which is usually within the hour, we try to have it.
And then our risk manager puts it all together and she emails it out to hospital-wide of any findings that we have, which is good because then everyone can see what we're finding from the post-fall huddles also.
I think our actual goal is to do it within 30 minutes, but sometimes patient care gets in the way.
Mm-hmm.
And how many people are on your fall committee?
How many do we have? 7, I think.
There's 7 of us.
Yep.
All nurses or other departments as well?
We have one administrative member, and then the rest are mainly nursing, and then we did just ask our safety officer to participate, and he's joined us as well.
And he also does plant services, so it's nice since he does the outside work.
So we got a combination there.
Sally's on the committee. She's our risk and quality, so we have a little bit of that. Generally, infection prevention. We all wear so many hats in a rural facility, so you kind of got a lot of people thinking together.
Okay, thank you.
Welcome.
And then, Deborah, we also got another question. You'd mentioned that your nurse ratio was 6 to 1. What is your CNA ratio?
Yeah, it's just, we have one CNA for our floor.
And our census usually for inpatient runs around 4 to 5, and so we don't really have an issue.
Okay. And then another question that's come through the chat, for your Matter of Balance classes, which department teaches those courses?
We actually have 3 nurses that were certified for being Matter of Balance instructors. And so that way we can alternate and provide the classes. But they are mostly nurses. And our Tai Chi instructor is also a nurse.
Are the nurses paid to teach those courses, and when they're teaching the courses, is that part of their paid time, or is that outside of their paid time?
No, they are paid to do that. So the hospital is doing that for the community.
And the people who teach their job duties, you know, aren't like a staff nurse, most of them, so we can pull them out of whatever they're doing and schedule, you know, so it works into their daily work duties and their FTEs. Yeah, so it works pretty easy for us. And they're great teachers too. They're just, you know, good at that.
All right. Any other questions? We don't see anything more coming through the chat box, but of course you guys are all unmuted, so feel free to jump in the conversation.
All right. Well, Deb, I want to say thank you to you and your team. That was a wonderful presentation. I think gave a lot of people a lot of information to take back and implement in their own organizations. A couple things I want to leave you guys with today is first, I want you between now and our next fall webinar to think about if you know where your hospital stands with your HEN 2.0 goals. And if not, we'd really like you to reach out to your HEN Improvement Advisor or your goal reports to kind of see where your organization is doing with aligning with the goals. And our next Falls Prevention Community Practice will be May 17th at 11:30, and Waverly Health Center will be presenting for that one. And if anyone has any interest in presenting or has new ideas that they'd like to share, please let Jen Creekmore or myself, Jennifer Nutt, know. We'd love to get you guys on a webinar so you can share your information. And that is all I have for you guys, unless anybody has any last questions.
Are we going to get this slide deck sent to us?
It will. Yep. Is that fine, Deb, if we distribute your slides?
Yes, it is. That's fine. Thank you.
Okay. Yep, we will distribute that via email, and then also once the recording is posted online, you can also view them there. So we will get that taken care of. Any other questions? All right. Well, everyone have a wonderful afternoon. Thank you.